how are you doing? They're quite clogged, huh? Okay, let's take a quick look at you. Do you feel like it's both sides? Okay. Let's jump right into it then. Gonna feel me pulling your ear back just a little bit here. Yeah, I can see it's quite clogged in there, isn't it? Okay. Take a look at the other side. Yep, this side is too. It's pretty impacted, actually. Alright. Well, it looks like we got you in here in the nick of time, right? Keep that by me for right now. So you're having diminished hearing, and you're feeling like it's equal between both ears. Okay. Any ringing in the ears? How about any dizziness or loss of balance? Any pain? Just pressure, okay. How about, are you having any kind of sinus congestion or any postnasal drip? How about sore throat? Any fever or chills? Any nausea and or vomiting? And any recent swimming? How about any instances where your ears got waterlogged, say in the shower, in the bath? So, really quickly, I'm going to see if we can't make you a little bit more comfortable. So I'm going to go back in with my otoscope, while also using a tweezer, and see if I can't remove something that might help you at least hear a little better, and then we'll do a full-on clean, okay? Okay. So, I'm actually going to make my, if I can find the button, there it is. Okay. I need to make my stool a little bit higher. So, okay. If at any point this feels uncomfortable, let me know, okay? Because that's not what we want. A lot of the wax in your ears is pretty impacted, so I'm going to do really quickly, right off the bat, is actually give you some eardrops. These are going to help and hopefully loosen up some of that wax, which should help us get your ears cleaned out, okay? So you're probably familiar. I think I might have heard thunder. Sure did. You're probably familiar, sorry, but these are going to make your ears kind of fizz up a bit as it breaks up the cerumen that's inside of your ears. Shouldn't hurt, just might be a bit on the ticklish side, okay? Okay, gonna give that an opportunity to do its thing. And while we wait for that, I'm gonna do the rest of your exam. So, lower myself back down. Direct your gaze right here for me, okay? Right in between my eyebrows. Excellent. Then just look up for me, okay? Look at my finger right here. And then look right here. Can I have you open for me? Perfect, thank you. I'm not seeing any postnasal drip or any kind of redness that would indicate some throat irritation. Everything looks normal there. Sorry, got a little lost. Gonna listen to your chest, okay? And just go ahead and breathe normally. And now, can I get you to take a deep breath in for me, please? Good. and out. Again. And again. One more time. Good. Just going to listen to your tummy for just a moment. Okay. Everything sounds just fine. So that's good. So now if it's alright with you, I would like to palpate your sinuses, okay? So along the insides of your nose, along your forehead, your cheeks, and down. And I'm also going to be feeling for any lymph nodes in front of the ears, along the jawline, or down the neck. Okay? Let me know if, as I am doing my examination, if any of these areas feel particularly tender, or you'd like me to back off. Okay. So, to start, can I have you swallow for me? Good. One more time, please. I'm not feeling anything concerning. No swelling or lymphadenopathy, which is good. And your sinuses feel okay too. So I'm going to raise my stool again and take a look at your external ears, so the skin and the cartilage. everything feels okay. Just want to compare symmetry for a moment. Everything feels okay. So let's check. See if things are looking a bit more broken up, which seems to be the case, at least on this side. Looks like it's the same here too. So I think we're ready to start cleaning your ears up a bit here. So I'm gonna go in first with I think a pick, and then we'll do some irrigation just because I don't want to risk pushing anything deeper inside of the ears if we use water too soon. So this guy is very gentle. He has just this little kind of scooped edge as a fuzz, and it's perfect for kind of going inside and gently dragging out anything that might be in there, okay? So, not going to go in too deep with this one. We'll keep it very shallow, as we don't want to risk causing any kind of damage to the tympanic membrane. Which is very easy to damage. Grab my tweezers. go in with some water, okay? And I'm going to be placing this basin right up against your cheek so that way it doesn't spill onto your clothing. So you feel like that might be okay. Let's suction out a little bit here. You feel like that cleared it? Okay. Let me go in with a little more suction here. Get any remaining water. That is definitely looking quite a bit clearer here. Very nice. Okay. So I'm just going to apply just a few more drops just to make sure that anything remaining in there is able to drain out. Some fizzing is normal, that's okay. Because we're not going to be able to safely clean all of the wax out. It's always good to have some remaining. So I'll just put this here. Grab my tweezer. We're gonna start on the other ear now, okay? So in. Grab this. I'm gonna go back in with irrigation. Try not to spill the water. This is gonna go just right against your cheek. Okay. You feel that clear? Okay. Let's go in one more time. Okay. Going to go back in with a different otoscope now, looking at both of your ears, and I'm going to be using something called an insufflator bulb. What this little bulb does is it allows for a little puff of air to come through the otoscope speculum and into your ear. The idea is to make sure that as the air puffs into your ear, the tympanic membrane or eardrum vibrates in response. If it doesn't, that can indicate to me that there is wax deep in the ear or potentially fluid. Okay? And then we'll give you some drops on that side. So, okay. Feel my otoscope inside your ear. And here comes that puff. That side is moving appropriately. Let's check the other one now. Good. So, eardrum is vibrating. Exactly as it should be, which is great. So I'm going to administer One more dose of eardrops to your right ear. And then I'm also going to spray both of your ears, which is going to help and prevent any wax, as well as from developing and sticking to the outsides. It doesn't develop on the outside, but sometimes it can stick to the skin. So we'll let that do its thing for a moment, and then we will perform a quick hearing test just to make sure that your hearing is as it should be. So okay. So, what I'm going to do is I'm going to whisper a series of numbers into each of your ears. I would like you to repeat back the numbers that you hear from me, okay? So, 96, 32, 41. Good. 18, 27, 92. Good. 33, 36, 16. Good. 59, 72, 76. Good. Okay. So then see if I can find what I'm looking for. Okay. Two more tests. This one is pretty basic. I would like you to close your eyes and tell me what side you hear the tone, okay? Okay. So, close. Thank you. Good. Good. That was more complicated, but you did great. Excellent. Okay. You can open your eyes. So now we're going to do one with a more delicate sound. So this is actually an alligator forceps. And I want you to tell me when you hear it get close to your ears, or your ear. So I want you to look directly at me, okay? Don't look towards this. Tell me when it gets close. Good. Okay. Gonna do the other ear now. Tell me when it gets close. Good. Switching sides again. Keep looking right at me. No cheating. Last time on your right. Great job. Okay. So you can relax now. I think we have your ears at a good point where they are pretty clear and your hearing acuity has returned. Would you agree with that? Okay. So then, I do want you to continue using your eardrops. Do you have any left, or do you need me to refill? Okay. Let me just... Okay. Same pharmacy, the CVS on Main? Okay. Let's get that taken care of for you. Okay. So I'm going to give this to my medical assistant to have her call this in for you. We'll definitely have this for you by the end of the business day. And I can have her give you a call when she's done so that way you know about when you should go and expect to pick it up, okay? I would like to see you back in the clinic in 1 month for a follow-up. Sooner if you feel like your hearing is starting to suffer yet again, or if you start feeling that pressure in your ears, any kind of ringing, loss of balance, or just like your ears are starting to clog, then come on in sooner, okay? Okay, we'll make sure that we get you in. We usually have a few spots in reserve just in case patients like you need to be seen right away. So make sure you come in should any of those symptoms start to occur, okay? Okay. In the meantime, I do suggest refraining from any activities such as swimming, or if you take a bath, at least for myself, sometimes I like to lie down on my back with my whole head under the water except for my nose. It's like my little like blowhole. I don't know. I know it's weird, but that's what I do. I would ask you to refrain from doing that for now until we get your ears to a point where that serum in your ears, that earwax, is not reaccumulating so quickly as it has been. But so far we have not been able to go beyond a few weeks until your ears have been impacted again. So I think for right now it's best to hold off being submerged in water, okay? Okay. And as always, stay away from Q-tips. You can use them on the outside of the ear, not on the inside. If you feel like there's something inside of your ears, give me a call and we'll either get you in or I can coach you over the phone of what you can do to remove it yourself safely. Okay. Do you have any questions for me or concerns before I step out? Okay. Well, if you happen to think of anything, please feel free to give me a call, okay? Okay. It was really nice to see you. You take care.